Did you know that there are an estimated 1 billion people worldwide suffering from low vitamin D levels? Did you know that approximately 3% of human chromosomes are under the control of 1,25-dihydroxyvitamin D, the active form of vitamin D, and that almost every cell in your body that has a nucleus has a receptor for vitamin D? Well, here are 7 symptoms of vitamin D deficiency. Number 1, aching muscles. It is very common for muscle aches and pain to occur with use, such as new exercise. But muscle aches that are present without any good reason and that don't go away can be from low vitamin D. Low vitamin D can also give muscle weakness, especially in the large muscles close to the center of your body, in your shoulders, pelvis, and upper arms and legs. In small subsets of people, especially elderly, this can contribute to difficulty walking, increased falls, and give a waddling gait. In one large study of more than 1,200 patients, increased vitamin D intake reduced the risk of falls by 22%, and in another group of nursing home patients, 72%. There is also significant experimental evidence that suggests a relationship between vitamin D and muscle function, because mice without vitamin D receptors in their muscles develop significant abnormalities in their skeletal muscle when compared to mice with normal vitamin D receptors. Number 2, painful bones. Low vitamin D levels cause release of parathyroid hormone. This mobilizes calcium from your bones and softens your bones, and is known as osteomalacia in adults and rickets in kids. On X-ray in adults, this is seen as osteopenia or thin bones. It also produces characteristic symptoms of bone pain. Bone pain is usually most pronounced in the lower spine, pelvis, and lower extremities, as well as anywhere fractures have occurred, and may be associated with tenderness to palpation. The pain is characterized as dull and aching and is aggravated by activity and weight bearing. Fractures may occur with little or no trauma, typically involving the ribs, vertebral bodies, and long bones. Number 3, low moods. Vitamin D is important for neurotransmitter function in the brain. It is important in the regulation of dopamine and serotonin, associated with depression, happiness, and anxiety. Several studies show the link between vitamin D and depression and seasonal affective disorder, the low mood that occurs during winter months from lack of sun exposure and mimics depression. Vitamin D may be an important treatment for seasonal affective disorder. Small studies show it to be more effective than phototherapy or lights that replicate the sun. A 2021 study in England found those with consistent hypovitaminosis D more likely to be depressed than those with high levels of vitamin D. However, a recent large study in greater than 18,000 patients showed no benefit to vitamin D supplementation over a 5-year follow-up for depression. We know that vitamin D is important in the brain and involved with mood control, but isn't necessarily a treatment for depression. It may be that depressive behavior causes people to ingest less appropriate food, engage in less activities that expose them to sunshine, and be more obese, all which can cause lower levels of vitamin D, but is not yet completely well understood. But there is enough association that it makes sense to have normal vitamin D intake if you experience low mood. Number 4, hair loss. Recent studies have revealed a substantial link between vitamin D and alopecia, which is hair loss. Interestingly, mouse experiments with low vitamin D leads to hair loss on mice as well. Hair loss occurs when the hair follicle in your skin is destroyed. Vitamin D has an important role in preventing this. Alopecia occurs when your body and its protective cells, natural killer and cytotoxic T cells, think your hair follicles are invaders and then attack follicles and destroy them. Vitamin D helps your body recognize a follicle as a part of your body and prevents cells from attacking it and destroying it. Calcipotriol, a vitamin D analog, has been reported to be topically used in treating alopecia with promising results. Number 5, wound healing. Research suggests a correlation between low vitamin D levels and hard-to-heal wounds. However, it is not clear if the relationship is causal or only correlational, because wound healing can be secondary to overall nutritional status, and often those deficient in vitamin D may be missing many other nutrients as well. Studies show that vitamin D supplementation for 12 weeks among diabetic patients with wounds had beneficial effects on sugar levels. Improved glucose management promotes skin healing, and therefore vitamin D plays a role in wound healing due to its effect on improved sugar control. Number 6, dizziness. We are now learning about the role vitamin D plays in helping patients with dizziness and vertigo. Benign paroxysmal positional vertigo, or BPPV, is the most common cause of positional vertigo. Vitamin D deficiency may be one of the causes of its development, according to an article in Nature in 2021. Those who have vertigo and are deficient in vitamin D also have more severe symptoms of vertigo. This is because calcium carbonate crystal abnormalities on hair cells in the inner ear is the accepted reason for vertigo. In vertigo, these crystals are dislodged, and vitamin D plays a major role in calcium metabolism, because it helps determine the density and makeup of the crystals and therefore how well they function. Number 7, reduced cognitive function. There are receptors for vitamin D throughout the central nervous system and in the hippocampus in the brain. Animal and laboratory studies suggest vitamin D protects neurons and reduces inflammation. Converging evidence also suggests that vitamin D deficiency affects multiple brain processes, including cognitive functioning, through channels and membranes and neurotransmitters. Cross-sectional studies have consistently found that vitamin D levels are significantly low in individuals with Alzheimer's disease and cognitive impairment compared to healthy adults, and that people with lower vitamin D levels exhibit slower information processing speed, especially men older than 60. There are many additional symptoms, including fatigue, reduced endurance, heart problems, obesity, recurring infections, problems sleeping well, and excessive sweating that are associated with vitamin D deficiency. There is not nearly as much convincing evidence, though, as for the others. Regardless, there is still plenty of good medical evidence to convince us all that adequate levels of vitamin D are important. For more information, watch this additional video on vitamin D to see if you are at risk and hit subscribe.